keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. You all know proper skin protection is the best thing you can do for the health of your skin today and slow down the effects of aging tomorrow. In today's era, changing weather with excessive heat or humidity increases risk of damage due to UV rays, which makes skins more prone to wrinkles, melasma, and even skin cancer. We know that sunscreen is valuable from a skin cancer and sun damage perspective, as well as something that helps prevent fine lines and wrinkles. According to a survey, 67% of people in India are not using sunscreen as daily skincare routine. Several things about sunscreen that we people are not aware of and that make us not include sunscreen as an integral part of our skincare routine. So to keep you informed, today we are here to know more about sunscreen as a regular skincare regimen. So let's connect today with our skin expert, Dr. Kumar Kaleeswaran, consultant dermatologist from Dindugal, Tamil Nadu. Dr. Kaleeswaran is a passionate dermatologist with more inclination towards clinical dermatology and dermato surgery. He has pursued his MD in dermatology from Sri Manakula, Vinayagar Medical College and Hospital, Pondicherry. Today, with his expertise, Dr. Kaleeswaran will enlighten us on sunscreen and skincare regimen. A very good afternoon to you, Doctor. Hope you are doing good.
Yeah, good afternoon. I'm fine. I'm good.
Great. It's a pleasure to have you with us. And today we are going to discuss a very important topic indeed, that is sunscreen as a skin care routine. Now, the thing is that we feel, because the name itself says sunscreen, which we can process that it is a protection layer which protects our skin from the harmful effects of the sun or the rays emitted by the sun. Now the thing is, does we only use sunscreen when we are going out under the sun? But then we often get to hear that it's important to wear sunscreen each and every day, regularly, religiously, and repetition is equally important. Now, what I would like to understand first is, why should I wear sunscreen every day?
And I think the people have misunderstood it. It should be called as photo screen rather than a sunscreen. So it is just not protecting from the sun rays. Even the light is a wavelength. You should know that light travels in a wave. So
Right.
even the artificial lights we have in our homes, in our offices, are all the same wavelengths. The wavelength is the same. Even the phone we are using, it has the blue light wavelength. The wavelength, the light is a wavelength. So we should protect from the light. It's not from the just from the sun rays. So it should be called as a photo screen rather than a sunscreen. So that is why there is a misconception that the people should use only the sunscreen when they go out. It is it can become a misunderstood. So I think we should educate the patient that it is a photo screen rather than a sunscreen. So all the wavelengths are the same. The light is a waveform. So yeah, all the light emitting things such as the tube lights, the laptops, the phones, we are using smartphones. So all have the same wavelength. So we should protect from the wavelength. So we should educate the patient it is a photo screen rather than a sunscreen.
Fair enough. So I think it's high time we rename it as photo screen rather than sunscreen. Maybe people will get more aware of it. And definitely this whole purpose of having this session itself is to educate and aware people more about sunscreen and why it's so important and essential. Now, doctor, whenever we go out and buy a sunscreen for us, there are so many, informations on the box. The very first thing that catches our eyes attention is SPF, sun protection factor. Now, what is that? How it works, and how to choose the appropriate SPF as per our conditions, etc. Which SPF should one go for?
Okay, the SPF stands for sun protection factor, but the recent consensus people are telling it should be renamed as sunburn protection factor, not a sun protection factor. Now they had renamed it as sunburn protection factor. There are different kinds of SPF ranging from SPF 2, 15, 30, 50 plus. So when we go out, we should optimally buy a sunscreen with the SPF of 30 to 50. I usually advise my patients to get SPF between 30 to 50 if they go outside and buy a sunscreen. So it should be between 30 to 50. After 50, it has a diminishing returns. For example, SPF 15 gives a sun protection factor of 92%, but SPF 30 will give you a sunburn protection factor of only 95%, only marginal difference of 3%. So after SPF 30, you give SPF 50, which gives sunburn protection factor of 97%. So the higher the SPF you go, you get a diminishing returns. At the same time, it won't be aesthetically pleasing if you are putting a higher and highest possible sunburn protection factor. It won't be aesthetically pleasing for the patient. So when you are going out to buy a sunscreen, you should buy a sunscreen with a label index of sunburn protection factor between 30 to 50, and it will also should have PA+++, which stands for protection against UVA. So the sunburn protection factor only mentions about the protection against UVB. So all the sunscreens will protect you against UVB, which causes sunburn. But UVA, which is most of the time we are exposed to UVA. Our sunlight, what reaches us, mostly 90% it will be UVA. Only 5 to 10% will be UVB. But the UVB is responsible for sunburn. That's why we have the sunburn protection factor. But the UVA penetrates deeper into the skin and it may cause cancer, like photoaging, wrinkles. All these effects are mainly due to UVA. So you should always look for a sunscreen which has PA+++, which indicates it's also protecting against UVA. So they should have a broad spectrum, not just the UVB, but also the UVA.
So we should go for a broad spectrum sunscreen, and definitely 30 to 50 SPF is good enough for the Indian conditions that we are in. And doctor, there are again, other informations as well. You said the lights that are, emitted from the screens that we are, always glued to these days, especially the laptop we are working in front of, or the mobile phones, or the other light sources, etc. They are also harmful for our skin. Again, when these days we go for buying a sunscreen, there are informations like it protects you from the blue light or the infrared light. So if we have more screen time, can we go for all those things as well?
Yeah, because certain for example, the sunscreen is broadly classified into physical and chemical sunscreens, which is a older nomenclature. Now it is called as organic and inorganic sunscreens. So most of the sunscreens contain inorganic substances which absorb wavelengths, specific wavelengths. So it should be a mixture. It should contain all the materials, chemicals that should absorb the particular wavelength. So if you are more into laptops and you are using phones all the time, for example, even the recently launched smartphones, I think last week one smartphone was launched, famous brand, which says it has 2000 nits of brightness, which is more than enough to see in a brightly lit the room. So it contains lots of wavelengths is going to hit you on the face. It contains lots of wavelengths. It should contain all the chemicals suitable for that particular wavelength, which absorbs that sunscreen, or it should refract that light. Basically, a sunscreen should absorb it or refract it. So we should use a specific sunscreen. If you are more into laptops, you should see that it has a blue light filter in it. Then it will be aesthetically pleasing also for you.
Okay, doctor. And again, how much quantity of sunscreen we need to apply and how often we need to reapply it. Please shed some light over that, doctor.
Yeah, sure. This is the most common question I get from a patient. They usually they ask me how much you should apply. If you are asking me, if you ask a dermatologist, they usually tell you should apply at least a 2 finger. You should apply at least a 2 finger. But in our skin type, if I tell the patient to apply this much sunscreen, she won't be following it. She or he won't follow the sunscreen. It won't look aesthetically pleasing. So first we have to prime the patient. We should not just focus. We have to just get them into the habit of applying the sunscreen. Something is better than nothing. That's I believe in that. So I just want to get them into the habit of applying the sunscreen. So I usually ask them to apply at least till what, two finger creases, which comes to one finger. So at least one finger you start applying it, then the patient becomes accustomed to it. Then you can gradually tell the benefits of the sunscreen, educate the patient, so they will then move on to the two finger rule. So at least you have to apply by the books. You have to apply at least two fingers of sunscreen. But I start with the one finger rule, then move on to the two finger rule, and you have to apply at least after within 2 to 3 hours. You have to apply the keep reapplying the sunscreen, because you use all kinds of things. We use makeups, we use sometimes we sweat a lot. At that time the sunscreen usually it's used to go away. Some people have a habit of keep on having their handkerchief close to them. So everything matters, the how much times they wash the face. So eventually you should apply the sunscreen every time you even wash your face. Now they are telling it's better to apply the sunscreen even every hour once. If the sunscreen should be applied at least within every 3 hours, and two finger rule should be followed. But I don't enforce the patient at the start. I just ask them to apply till two finger creases, which comes to one finger.
Exactly. So the bottom line is that if someone has not yet started using sunscreen on a regular basis, they
Yeah.
should start it right away and start with one finger rule. One finger, what doctor just explained, and you should cover your face. And
Yeah.
eventually you'll just grow as a person and start using it as per the books or the parameters set by the book. Now, reapplication again, you said, you need to apply it, like many people now are applying it every 1 hour. But because again, application and reapplication is itself seems so much of, hard work or tedious, many people I'm sure doesn't reapply. Now, what is the basic thing to, why it's so important to reapply a sunscreen?
So, as I already told you, the sunscreens are made up of chemicals which are usually photostable and photo unstable. Once they absorb that wavelength, they transform into another molecule. Sometimes they dissipate into heat. So it is basically all the sunscreens are measured by applying at least 2 mg per centimeter square. We can't apply that much amount of sunscreen to our face and the neck. So if you at least reapply it, you will get that amount of sunscreen into your face and the neck, with whatever the body part is exposed to light. So you will reach the optimum sunburn protection factor at that time. So it is very important to reapply it. If you are using a chemical sunscreen, it should definitely be reapplied, because the chemical sunscreens lose their effectiveness once they absorb the light and transform into another structure. So they lose the efficacy. That's why we should apply the sunscreen within every 2 hours or every 3 years.
Okay, so application, reapplication, regular application is really important in case of sunscreen. Now, again, there are so many people who complain about various things in sunscreen, like they say their face becomes very dull or patchy, or they sweat a lot after using sunscreen, or their skin becomes more oily after applying sunscreen. Now, how would you like to counter all the complaints or excuses people normally use?
Yeah, it's a good question. Many of my patients ask, when I give them the sunscreen, they will after 1 week they come and tell me that they have become dull after applying the sunscreen. So it is a question I frequently get asked by my patient. The thing is, when they apply the sunscreen, they don't apply it properly. Sometimes you should give the sunscreen based on the skin type. For an acne prone skin, you should give a gel rather than a cream or a lotion. Gel should be given, should be prescribed for the patient for an acne prone skin, and for other body parts like hands, legs. I usually prefer lotions compared to gels. So the spreadability will be easy. And uh, usually the sunscreen should be non-comedogenic. When you are giving in acne prone skin, we should be careful that it is a non-comedogenic sunscreen. And usually if they apply a gel based sunscreen, it is better tolerated. And as I told you, the one finger rule, if you follow the one finger rule, then it won't make you dull at the first week. Then you gradually increase to the two finger rule. Then the patient get accustomed to it. So if you follow that rule, I think if you follow that rule, it won't make you dull immediately. And there are also nowadays various forms of sunscreens. Even there is tinted sunscreen is available for the patient who are complaining of having they are looking a bit dull. I usually prescribe them the tinted sunscreen based on their skin color.
Okay, so it's important to keep in mind the skin type before going and buying a sunscreen, and definitely a dermat can help us with that. So, in case you are confused which sunscreen to opt for, what's your skin type, in case you have any skin related issues, please go and consult your dermatologist and seek their advice for getting the right kind of sunscreen as per your skin type and as per your working conditions as well. Because, doctor, again, I'm sure people who are athletes or who go for swimming or who have more exposure under the sun, like they are, working in the field also. So there, for them, again, the SPF or what kind of sunscreen will suit them will differ from normal people.
Yeah. The people who are going for a swim, I usually give a water resistant sunscreen. There are two types of water resistant sunscreen, just a water resistant sunscreen and a very water resistant sunscreen. A water resistant sunscreen, it is not a waterproof. You should tell them a water resistant sunscreen will, will protect you only for 45 minutes of subsequent immersion in the water. So when you are even in the swimming, the light gets refracted into the water and it will just make you dark. Whenever we go for a swimming, there is a chlorine in the water. They get tanned easily. They believe that they are under the water and they don't get, don't need a sunscreen. But the thing is, in the water, the sunlight diffuses and you will get more tan if you don't use the sunscreen properly. So usually I advise the patient to use a water resistant sunscreen. A water resistant sunscreen is a sunscreen which stays in your skin up to 40 minutes of continuous immersion. If there is some professional athlete who's a swimmer, one time I had a patient who is a professional swimmer. So I have to give him a very water resistant sunscreen. The label itself tells a water resistant and a very water resistant sunscreen. A very water resistant sunscreen will have an sun production, it will maintain its sun production factor up to 80 minutes of subsequent immersion. So I prescribe them the very water resistant sunscreen for a swimmers. If they are outside, just they are playing, I usually get kids who mothers are now educated. They are asking me whether they have to apply a sunscreen to a kid. Yes, you have to apply a sunscreen when they were playing more than 1 hour in a sun. When they are more outside for a long time, you should better apply a sunscreen. So it should be a broad spectrum and it should have a sun production factor between 30 to 50.
Okay, doctor. And doctor, you mentioned while suggesting the best kind of sunscreen for acne-prone people that it can be, you normally as a doctor keep certain things in mind before prescribing a sunscreen for people who have acne-prone skin, like it should be non-comedogenic or it should be gel-based, etc. Now, but the issue is that acne patients normally do not use sunscreen. They have n number of complaints and excuses, like few which I have already mentioned, and they'll say that because for many their acne actually they are painful, so they don't like using something or rubbing something on their skin. Then they feel that acne will get worse if they'll apply sunscreen. What I want to understand is that why sunscreen becomes more important for acne people.
So it is a myth that has been installed in the patient minds that when you are having an acne, you should not apply a sunscreen. But it is totally wrong. You should apply a sunscreen when you are having an acne, non-comedogenic sunscreen, because acne is an inflammation. It is an inflammation of the sebaceous glands. So when you are without a sunscreen, the sunlight, as I told you, the UV rays, UVA and UVB will cause inflammation in the skin, which will further aggravate your condition, and it will also lead to pigmentation. It will also lead to uneven pigmentation. So I just educate the patient that it is an inflammatory condition. Acne is an inflammatory condition, and if you are not applying the sunscreen when you are having an acne, it will just aggravate the acne, and it will also lead to pigmentation. So if we educate the patient, and I usually tell them it is a non-comedogenic and it is safer to use, and if you are using a sunscreen, the treatment of the acne becomes more appealing to the patient, and the patient compliance becomes good with me, because when they apply the sunscreen, the pigmentation is less and the acne usually reduces better when compared to patients without using the sunscreen. The compliance is also good. So when you are having acne, you should apply sunscreen.
Okay, so anyways, you have got to apply sunscreen regularly, religiously. But if you have an acne-prone skin, you are having acne, please do not miss on your sunscreen. Do apply sunscreen. And in case you are confused about which one to choose, please go and consult your dermatologist. Now, you also mentioned pigmentation. The problem is that many people, especially women in India, suffer from hyperpigmentation or melasma, and we for a reason know that sun is one of the causes or reasons behind these hyperpigmentary issues or melasma. It could be one of the vital reasons. What I would like to understand again, doctor, is that can we prevent these by using sunscreen, or at least restrict these by using sunscreen?
Yeah, surely the pigmentary conditions like lentigens, melasma, everywhere, all these conditions have aggravating factor as sunlight. So when you are using sunscreen, the conditions such as lentigens can be prevented. It can also, if you are already having a blemishes or lentigens in your face, when you will keep on applying the sunscreen regularly, it will prevent the lentigens from appearing. Also, in melasma condition, the sunscreen should be applied, because the melasma, when you are exposed to light, the melanin is producing much. So melanin, which is getting produced, is a natural thing. So if you apply a sunscreen, it will just block the uh, melanin. It will just reduce the melanin production, because you are not exposed to light. Then the body doesn't need to produce that much melanin to protect you from the sunlight. So the basic, if you are having a pigmentation, you should use sunscreen. As you know, melanin itself is a natural sunscreen. If you are applying an artificial sunscreen over it, there is no need for the melanin to come out. So that's why we get tanned when we go out. Immediately we go out to very hot environment, we get tanned. So
Right.
because melanin gets produced, it's a natural response of the body. So when you are applying an artificial sunscreen, there is no need for the natural sunscreen melanin to come outside. So the pigmentation will reduce, and it will definitely prevent the hyperpigmentation or the blemishes or the lentigens or the melasma. You have to use sunscreen. It will help in preventing also.
That was a very important and interesting information that you just gave, Doctor. And yeah, one more thing, because continuously we are talking about the importance of sunscreen in our daily skincare routine, why it's so important about applying the sunscreen regularly, religiously. Reapplication is equally important. The amount of sunscreen that we need to apply is equally important. Now, my question is, many people ask this, that because I'm using sunscreen for the longest time maybe, and that's one thing that I got to use since my childhood till or whatever time I'm here. Is it safe for my skin? Is it toxic, or can I just go with these sunscreens?
Uh, It's absolutely safe to apply a sunscreen. There are many studies. There are lots and lots of studies have been done in the sunscreen. Even the chemical sunscreens and the physical sunscreens like zinc oxide, titanium dioxide, all have been tested extensively in the human skin. It is not even tested in the animal skin. It is tested in the human skin, and the absorption rate is very minimal because you are applying the sunscreen only on your face, neck, and legs, which constitutes only 10 to 15 percentage of your total body surface area. And it is the absorbent rate is very less. Even the nano-sized particles is not absorbed. There was a recent study where they had applied 40 percentage of zinc in a psoriatic patient, and there was no change in the serum zinc levels. They exclusively applied a zinc. Zinc is a physical sunscreen, so they applied up to 40%. We don't find 40 percentage zinc in our sunscreens, but they had applied 40 percentage zinc in a psoriatic patient, and the study showed no changes in the serum zinc levels, which proves that the sunscreens we are applying does not get into our circulation, and if it gets, it's very minimal, and there is no harmful effects of using a sunscreen for a long time.
Yeah, that was really important, and I'm sure all those viewers who have not yet started using sunscreen as a daily skincare routine will now at least start knowing that why it's so important. And yes, it is harmless, absolutely harmless. Again, doctor, initially we have spoken about people who are inside their houses, but in front of their screens or their laptops or under light, etc. They are equally, prone to the sun damage or the damage that the rays or lights are can have on their skin. Now, the thing is that work from home is the new normal for us. Many people are there who are working from their home, and they are still not convinced that why, they should go for sunscreen. You very well emphasize that it's high time we should rename the sunscreen with photo screen. But still, I'm sure you also have patients who normally say that, why should I use sunscreen? I'm working from the home. Okay, you are saying that if you're working in front of a laptop for long, long hours, then your skin is getting damaged by the rays emitted by it. But then I'm not working. I'm a housewife. I'm mostly in the kitchen. Why should I use a sunscreen? How would you like to counter all the things?
Okay. So in the kitchen, I think that everyone has a hob or something. This also emits the waves, the microwave ovens, and there should be a window inside the home. There is no home without a window. Even the chimneys have a light, blue light. Is now they are giving a high spectrum blue light which illuminates their workbench. So all those gets reflected and it comes to their face only. All those gets reflected. All those are like photo light. You are the chimney. I think every chimney has a light, and now it has become a fashion to illuminate entire countertops. I have seen my colleague has the entire countertop illuminated. So it is everyone has to use a sunscreen. These are also light forms. Even when you are inside your home, you have many tube lights. Now it has more, when we are in nowadays we are using lots of tube lights, lots of we are exposed to light.
Right.
Before us, we don't have this much light in our homes. Now we have lots and lots of lights. Nowadays we are having a big televisions. When I was a young age, even a 24-inch television was considered as a large. Now the 75 inches considered as a less. So see to it how much light it gets from the TV, television. So even our phones get larger and larger as the every year passes by, and it gets brighter and brighter. So even when you are a homemaker, even the nowadays refrigerators comes with the television. It has a screen to operate. So you should use sunscreen.
I can't think of any place where screens are not there. Screens are everywhere, and definitely none of us is living in pitch dark. So we all are under light or any source of light or screens, etc. So sunscreen is even more important for us. I'll also take some of the questions that our viewers are asking. Sashi Soni is saying, I lead a very busy life. I need to keep my routine really simple. And what are the absolute basics for that, doctor?
So as such, if you are using she wants a skin routine, just a skin routine. So I usually tell them a small formula. It is called a CMS. You want a cleanser, moisturizer, and a sunscreen. Just this.
Yes.
The cleanser should be a pH balanced cleanser and a good moisturizer suitable for your face. And as I already told you, a sunscreen should be between SPF 30 to 50, preferably a broad spectrum sunscreen. And having a protection against both UVA and UVB. She should follow a rule, simple rule, just cleanser, moisturizing, and sunscreen. CMS, easy to remember.
Okay, so CMS is what you need, Sashi. And we have Namita asking, what's the best way to handle sensitive skin? I'm 22 years old.
So, as a sensitive skin, you should use a pH balanced cleanser, and you should also see yes, your sunscreen contains silicone gel, because silicone products doesn't react with the sensitive skin. It just protects it. It just encapsulates the molecules in the sunscreen. It doesn't interacts with your skin a lot. So you should use the sunscreen which contains silicone based sunscreen should be used for a sensitive skin.
Fair enough. Asha Bohra is asking, is there any baby sunscreen so I can protect my baby from the sun?
Generally, I don't advise a sunscreen when a child is less than 6 months old. When a child is more than 6 months old, you can use a sunscreen, preferably non-organic sunscreen, which is called as a physical sunscreen. You can use a zinc oxide based sunscreen. This zinc oxide is better than titanium dioxide sunscreen. Make sure it has only zinc oxide. A physical sunscreen is good. You can use it for a baby more than 6 months of age.
Right. And Kathy Abuja is asking, Doctor, how's the effectiveness of a sunscreen is measured?
The sunscreen effectiveness is measured based on the, as I already told you, sunburn protection factor, which measures the amount of protection from the UVB rays, which causes sunburn. So the sunscreens are classified into SPF 2 to 15, 15 to 30, and the highest sunscreen greater than 50. When a sunscreen is labeled as SPF 30, it says it gives you sunburn protection factor of 95%. In simpler terms, if you are getting a sunburn, then you are going out in 10 minutes. If you use a sunburn protection factor of 95%, you will get a sunburn after 30 minutes. That is the simple term to know it. It is just a sunburn protection factor. It just increases the time you can stay outside. That's why you should keep reapplying the sunscreen.
Fair enough. Rekha Marun is asking how to deal with dry skin that's peeling and is sunburned.
Yeah. For dry skin, I usually use a sunscreen with there are sunscreens available with the moisturizing component. So you make sure you moisturize and then you can use a sunscreen. For a dry skin, I also advise them to use lotion-based sunscreen for easy spreadability. And as well as for the face, you can use a gel, as I already told. You can use gel-based sunscreen. It will also help you in moisturizing it, and also use a proper moisturizer along with the sunscreen.
Okay,
Or
doctor.
a combination of a moisturizer and a sunscreen.
Okay. Now, many people, especially those who have oily skin, they say that, why should I use a moisturizer? I already have a very oily skin. Now, what should a person with oily skin do, doctor?
So oily skin, you should use a silicone-based sunscreen as a gel form. It doesn't make you look more oily. And proper cleansing, you should have a proper cleanser. Many of my patients ask how to cleanse the face. They don't know how to cleanse the face. They don't. If I ask them what products they use, they tell a list of products. They don't have a proper moisturizer, proper sunscreen, but they use vitamin C serum. I don't get the thing. So because of the influencers, they are using the vitamin C serum. So you should wash your face properly, cleanse your face at least 2 times a day, which will remove all your sebum and all the dead cells. After that, you should usually moisturize the skin, and you should not. The moisturizer should be it should be a cream, not a lotion based moisturizer. For a face, you should not use a lotion based moisturizer, which will make you more oily. So you should use a cream based moisturizer and a gel based sunscreen. Then you won't get that oily look. And a physical sunscreen.
Right. So CMS is for all skin types. You need to have this cleanser, moisturizer, and sunscreen routine. And definitely, the products will depend upon your skin and various other things. And you can definitely go and consult a doctor, a qualified dermatologist, to seek advice on these things. Now, doctor, along with applying sunscreen, can we do something else, especially if you're under the sun, like clothing or hats, etc.? Does they work?
Yeah, even when you are using a sunscreen, you should probably, if you are exposed to sunlight for a long time, when you are having an outdoor activity, I advise them to use a hat, sunglasses, preferably sunglasses, and long sleeved dresses to protect from the sunlight. We should properly educate the patient that you have to, over the sunscreen, you can use all these measures to protect you from the sunlight. Because even though I keep on emphasizing them to reapply the sunscreen, I do not find many patients reapplying it. So I usually give them these advices for an extra protection, like using a hat, sunglasses, and long sleeves. I usually tell them these things also. It will also help then from preventing the sunlight from getting into your skin.
Okay, and many people who are, traveling or maybe going to hill stations or going somewhere during monsoon or during winter, they'll often say that, see, I'm not beach vacationing, right? I'm in the hills. It's really cold. There's no need of applying sunscreen. I'm not even working in front of a laptop or anything. So why is it important to use sunscreen even when it's not sunny, even when it's cloudy or we are uphill, etc., doctor?
Uh, so this is, I think this is totally wrong, because when you are in hill station, the altitude is very high. You are much closer to the sun. You are closer to the sun. So the most of the sunlight, even though it is cloudy, you are so close to the sun, the wavelengths easily comes and hits in your face and neck and all sun exposed parts. So preferably, the logic says when you are closer to the sun, you should use more sunscreens. So if it's cloudy, it's not like that. You should not use a sunscreen. If you are when you are going up into the hill station, the altitude is very high. You are much closer to the sunscreen. There are studies saying that at a sea level, the UVB is 10 percentage, but at the higher altitude, UVB is much more than the UVA. You get sunburnt a lot, and there are also, when you are going to hill station, there will be snow. All these will reflect the sunlight, so it will again damage your skin. So you should definitely apply a sunscreen even in your vacation and you are going to a hill station. It is a must to apply the sunscreen, and you should educate the patient that when you are going high, the sun is much closer to you. Then you should apply the sunscreen, and the snow, everything will reflect the sunlight much more. So you should apply it. You should definitely apply the sunscreen when you're in a hill station.
So no matter you're under the sun or working from inside your house or offices, or you're working in front of a screen or not, or you are going up hills or you're going to a beach, no matter what, whether it's cloudy, it's raining, it's wintry, it's not sunny, still you need to use sunscreen. It's really important, very essential, and you need to religiously follow a sunscreen based, CMH based skincare routine regularly. Now, doctor, before we wind up the whole session, any take home message for our viewers?
So I just want the patients to get educated. All in our Indian homes, we apply talc, everything, but we forgot the sunscreen, the most important part of a skincare routine. So don't get afraid of sunscreens. It's not going to damage your body. It will be absolutely, it will make your skin look younger. Compare, it will make you wrinkle. It will give you the younger look. So it will delay your photo aging. So you should use a sunscreen, preferably, as I already told you, a sun protection factor of between 15 to 30, and broad spectrum sunscreen. Make sure the label says protection against UVA, which says PA plus plus plus. So my take home message is apply sunscreen, apply it regularly, reapply it, and don't forget the CMS rule: cleanse, moisturize, and sunscreen.
It was wonderful talking to you, Doctor. Thank you so very much for your valuable time. It was great hearing you, and we really look forward for many more such sessions for our viewers in the coming times. Thank you so much once again.
Thank you. Thank you.
And viewers, thank you for your participation in today's session. Stay connected to our beautiful Spotless Skin page. Thank you. Have a great day ahead. Goodbye.
Like, subscribe, and press the bell icon. Thanks for watching.